Good morning, Dr. Shabnam, and it is so good to see you again. Thank you so much for doing this. And before we begin, let me introduce myself. My name is Akash. I am the founder of SutraLETICSS. SutraLETICSS is a company where we integrate the sciences of East and West coming together and providing a solution for people, mainly focusing on preventive healthcare. And before I talk more about myself, let's move over to Dr. Shabnam. Dr. Shabnam, if you could just say a few words about yourself, you're a functional medicine doctor, and a little bit about your journey.
Thank you, Akash. Thank you very much for having me on your program today. And I'm Dr. Shabnam Das Kar. I am a functional medicine consultant. So I'm a physician from India. Now I live in Alberta in Canada. And my journey is kind of long, Akash, so I'm going to give the brief version. So by background, I was an OBGY, so I was practicing in Mumbai for many years, doing deliveries and surgeries and all that. But quite a few years ago, I have transitioned completely into functional medicine. So I did a fellowship from the US, from the American Academy of Anti-Aging Medicine. And now my specialty is essentially lifestyle medicine, so nutrition and the other factors in lifestyle medicine. And the area that I really love is to create individualized treatment plans for patients. And today the topic that we are planning to discuss is strength training, building muscles. Why is that so important? So Akash, what are the challenges that you find that when you talk about strength training? What do people usually tell you? And then I'll give you my perspective on why I'm so sort of obsessed about it, but at the same time I can't say it's an easy solution also.
Okay, first of all, I actually want to thank you for coming out with this topic because it is very fascinating, very intriguing, and yet so misconstrued. But before we begin, let me just give you a little bit about myself because I don't want people to feel that kind of I am biased towards a particular protocol because I'm a strength training coach, so I will only talk about strength training. But it's not like that. So yes, I started pretty early in college strength training. I actually grew up as an obese kid. I was pretty obese,
Oh, okay.
and then I mean, long story cut short, I got into exercise, and it was strength training, and it was through strength training that I actually got into shape, lost a lot of weight, become healthier, etc., etc., and then also got into yoga somewhere down the line.
Mhm.
While I also got into yoga, I also used to. So I used to be a very obese kid, and my mom was very after strict after me, wanted me to lose weight. So I did almost every possible activity, right from horse riding to martial arts to
Wow.
sports to cricket. I mean, you name it. I've probably done it all. This is all thanks to my mom. And so I've essentially actually done almost tried my hand at everything. So it's not only strength training, but I always say in the end, it always I don't know, whatever you love, whatever you're supposed to follow, it kind of stays with you. So just because we're talking about strength training, it's a lot of science behind it, and we will discuss that. And in no way am I biased towards it because it works. We all know it works, and hence, that's why it is. Uh, and one of the so couple of challenges. So like I said, I started pretty early in college. Also started training in really small gyms, bigger gyms, even bigger gyms. I was living in Dubai for some time, trained in gyms over there. Have met with a lot of fitness trainers in India, abroad also. So I kind of have an idea of what goes on in gyms. When you look at women coming to train, when you look at senior citizens coming to train, when you look at children coming to train, the challenges that they face, the challenges that trainers face, and there's so much that needs to be done. And
Mhm.
essentially, everything comes down to one thing, which is knowledge.
Mhm.
Unfortunately, people are there are so many preconceived notions, so many stigmas attached to strength training that some people just kind of the minute you mention that topic, the expression changes on their face. So
So
if it's
Akash, I'm going to interrupt you now
sure, go
because
ahead.
let us, will you explain for our audience who don't know what strength training is? That what is it we are talking about?
So great question. Let's if you look at the definition, okay, so strength training is any physical activity that uses external resistance to induce contraction of the muscle and thereby induce hypertrophy. Hypertrophy is increase of size in muscle. But one of the most, and I would say the overlooked fact of strength training is strength. It comes in strength training, okay. But unfortunately, people very conveniently forget strength and they only look at training. So what do we have? What do we have? We have people training but not training for strength. So if you ask somebody that why are they in the gym, so people will tell you, oh, you know what, we want to lose weight, or we want to gain weight, or we want to maintain
will
weight.
go down that route.
But nobody talks about strength, and essentially, it is so wrong for people to look at all these goals that they have. But the only goal that people should have when they're in the gym or when they're strength training is strength.
Yeah.
The only goal should be building strength. Everything else, believe it or not, is a side effect. Everything else will happen automatically. You want to lose fat, it will happen. You want to gain muscle, it will happen. But you have to focus on gaining strength. You know, there is this there is this. I don't know if you know Kezat Kapadia sir. I'm a student of him, and he is one of the biggest names in fitness we have in India. So he says this is a very simple way that every inch of muscle that you gain should translate to strength. Believe it or not, there are people who look very big, who are very muscular, but they are not strong. It's because how
does that happen, Akash? Like
see, normally it's amazing. Yeah. It's amazing how that works. So can you imagine there are guys who you could even call them many professional athletes and bodybuilders. It's because the way they train. So muscle, hypertrophy is increase of muscle size. Now, how do you facilitate hypertrophy? Hypertrophy is pretty simple. Okay, you give enough resistance to the muscle, so there is muscle breakdown, and when the muscle recovers, it increases in size. You give it protein, that's nutrition, and you will have hypertrophy. But you will not gain strength.
Okay.
So gaining hypertrophy is possible. Okay, with really light weights. This is what most people do. But to gain strength, you really need, there is a particular way of, the intensity comes in the picture, how heavy you go lifting, all that comes in picture. So there are two ways actually. The people who train only for strength, there are people who train only for hypertrophy. But the beautiful thing is that you want to train for both. So you get the benefits of both. So this is where people, have this misconception.
Okay. Thank you, Akash. So basically, my perspective is more of, someone who's looking at movement and exercise from the view of, health. This is not necessarily, because the two are quite different. One is the one who are into performance and bodybuilding and all that, and a lot of athleticism. That is actually quite different and needs a lot of specialized care from people like you, people who know about sports nutrition and all those things. That is not my area of expertise. Mine is the general health category, where my primary goal is to get people to start moving. And why I focus on building muscles is, and one thing people don't understand, Akash, and I'm sure you've met a lot of people like that, is diabetes is so common in India. So obviously, if 90% of people have pre-diabetes, many of them not even diagnosed, their muscles are a very important part of that entire condition. So unfortunately, in India, people start losing their muscle glucose sensitivity, which means the muscles are the main organ where once you use the muscles, it utilizes a lot of glucose. So if it uses glucose, obviously the blood glucose level will not go up. So they should not develop diabetes. And there are various reasons. There are some genetic causes as well, which makes South Asian muscles a little different when compared to people of Northern European origin. And the other thing is, of course, the sedentariness. Now, what I find, Akash, in my practice is particularly women, not so much men. And you will notice that the fact that I'm talking about Indians losing muscle early, you'll find there are a lot of men, particularly middle-aged men, who have maybe a little bit of belly, and their the gluteus maximus, the buttocks are like quite flattened. They don't wear shorts because their legs are very thin. So they've lost a lot of muscle, and many of them have diabetes and high cholesterol and all those problems. But they are not looking at building muscles, because that is the one thing that would have made a huge difference to their diabetes, to their general health. So the most important reason why we need to build muscles is, number one, for better metabolism, and number two, if you're looking at longevity and aging, muscles are the ones that are going to prevent us from falling. And a person at the age of 70 or 80 falling is not a simple thing. It's like some of them never get out of bed again. So for long term health, it is very important to build muscles. Now, Akash, one thing I find is, many women will say, "Oh, I don't want to become like a bodybuilding woman." I said, "No, that is not possible, because women don't have that kind of muscles."
Exactly.
So do you get that a lot? Like they will work for 1 hour on the treadmill, but they are not going to do any weights?
Okay, so firstly, coming to your okay, what you just said in a couple of parts. So the first thing was that the reason why we formed SutraLETICSS is the platform that we have is basically to cater. So being in this industry for so long, I found that, and it's not really right, that there's lots happening for people who already exercise. There's lots
Yeah,
happening for people who are
yeah,
athletes, who are bodybuilders, who are already into fitness. Lots happening
yes,
in gyms. But there's nothing happening for people who are sitting in the house. There's nothing happening
yeah.
for housewives. There's nothing happening for senior citizens. There's nothing happening for children. Okay.
Hmm.
Hence, SutraLETICSS is a platform essentially for them. I mean,
Okay.
I'm not saying that we're not going to cater to fitness athletes and
Yeah.
of course we are there, okay. But we want to look at people. We want to get people to move, because the body is
Hmm.
designed for movement, as we
Yes.
know, right? We need to
Yeah.
move every day. We need to move. It doesn't really matter what activity we do.
Yeah.
Yes, of course it does eventually, but
Yeah.
you still want to move. You want to facilitate that movement every single day. Okay, now
Hmm.
the problem that about strength training and women is many of them have a kind of a mental block.
Hmm.
But believe it or not, when I have trained women, I have trained women who have absolutely averse, who have been averse to strength training, who have never entered a gym in their life. Okay, but I have trained them and now they love it.
Yeah.
Okay, so I think it all depends on education, awareness, and the right kind of training.
Hmm.
If you train them correctly, it becomes a part of the routine, part of their their discipline, and they love it. And same even goes for senior citizens. Uh,
Yeah.
uh,
Absolutely.
I train. My mom is is a senior citizen, I take a special session now that it's locked down. We don't go to a gym, but 3 times a week I am training her at home, and I'll
Oh
share
wow.
videos later, and you'll be amazed at from where to where she has reached in such a short span of time. So
That is really wonderful.
it's all about creating awareness.
Thank you,
It's
Akash. So, few more things I wanted to highlight is, now recently in 2020, actually, the World Health Organization came up with newer recommendations for exercise for everyone. That's for health. And what was 150 minutes a week of moderate intensity exercise is now 300 minutes of moderate intensity exercise. And I know that, even earlier people were not meeting just the basic requirement. And the other thing is, probably for South Asians, the requirement may be more. So let us say now, I don't meet the moderate intensity 300 minutes exercise requirement a week, definitely. So for someone like, you talked about all these ladies who had never visited a gym, what would you suggest they should start off with? Like they go to your to your center.
so
What would be some of the ways to get them to start getting into building muscles and strength training?
So, talking about the recommendations, recommendations are great. We have the RDA, which is daily recommendations for nutrition, for supplements and vitamins also, but we don't essentially always go by them. And as you all
Mm,
know, the perfect example is you look at the RDA for the vitamin D3, it's not
mhm.
really, it's pretty low,
No.
on the lower side. We definitely need much more on a daily basis.
Yeah.
Same thing with exercise. I would say without looking at it's great to have it as a guideline, but when
Mm,
it comes to strength training, I would say starting with two sets. Like for somebody who's just starting out, or there's some ladies and some senior citizens who's just starting out. I would say twice a week is a great place to begin with, and eventually get to maybe 3 times a week. and then maintain that three
Okay.
times a week. You don't really need. Also, another misconception that people have is that you need to be in the gym the whole day. You need to sweat it out for 2 hours, 3 hours. That
Yeah,
doesn't work.
I
Okay,
know.
another, so it's because you're CNS. There is only so much that the CNS can handle at one time. For
Yeah.
those of you who don't know, CNS is the central nervous system that actually controls everything. Your rest, your
Hmm.
recoveries, everything monitored by your CNS. So especially when you're starting out, there is not too much load, too much intensity that the body can handle
Hmm.
at the beginning. So even half an hour, even just a half an hour session 2 times a week of basic exercises is a great way to start for people. Be it senior
Hmm.
citizens, be it children, be it housewives, be it any sedentary person. That's a great way to start.
Thank you, Akash. That brought up something else to my mind. Is I think it was last year or this year. The Canadian guidelines have added something really wonderful. So they've added something called 24-hour exercise guidelines. So essentially, it is not just exercising for half an hour, 15 minutes, 3 days a week, or once in the morning, but what you mentioned, twice a week, thrice a week, moderate intensity exercise, and incorporating movement for the rest of the day, and preventing continuous sitting. So that is the sitting disease that we talk about. And one more interesting thing is they focused on sleep as well. So these were the three different components. And I found that very interesting because I think this is the first time any major organization has come up with daily movement, and they have it for different age groups, for children, for older people, everything. That is much, it makes much more sense than saying, oh, you need to exercise for 150 minutes a week or 300 minutes a week. So that is one very important thing. And another thing is, Akash, I find that a lot of older people, and sometimes older people have a whole lot of illnesses, like they may have heart disease and diabetes and hypertension. Many of them are afraid to start with any kind of exercise. Is that what you see in your in your practice as well?
Okay, so strange enough, this is just to answer this question exactly. So about what was it? When we were supposed to meet, what was it? Day before yesterday? Was it yesterday? I
Yeah,
can't remember. So
yeah.
just before our meeting, I just finished a session on an online session for senior citizens.
Okay.
Okay, it was a very brief half an hour session. It was by a group of they have this weekly meeting, senior citizens based in Dubai, but
Mm-hmm.
globally all over. So I think there were
Okay.
20, 30, 70 plus, 60 plus people over there who have probably
Mm-hmm.
never heard of the word strength training, never
Okay.
exercised, never. I mean, entering a gym would have been way too to think far
Yeah.
fetched. But these are the people who walk, only walk. So that's another
Mm-hmm.
thing that people only think about: walking, walking, walking. You have diabetes, the diabetologist tells them walk half an hour every
Yeah.
day, and that's it. So it was interesting because I'm actually going to post on this on my social, that how do we structure a program which is not intimidating. It shouldn't intimidate them. At the
Yes.
same time, you want
Yeah.
to encourage them to exercise. So I
Yeah.
had picked up really basic, very, very simple movements. So I don't
Yeah.
even call them exercise because the body is designed for movement. So
Yeah.
when you sit on a chair, you squat. That's a movement.
Yeah.
We don't think, oh, you know what, you're going to use your quadricep, you're going to use a hamstring and glutes to
Yeah.
sit. We don't talk about that. Actually,
Mm-hmm.
even as a trainer, I don't really like to talk about muscles. It's more about
Mm-hmm.
movement. Hip
Yeah.
hinge is a movement.
Yeah.
Overhead, lifting a weight overhead is a movement. Your muscles
Mm-hmm.
will automatically get recruited in the movement. So I just
Mm-hmm.
picked three, four very, very basic movements that covers your entire body, that the movements that the body is designed to, and I just demonstrated them, and they were so happy with it because no matter what pathology or not, what medical issue you have, everybody can do them.
Absolutely. So this is where, particularly after heart disease, I mean heart attack and all that. Again, there are very structured exercise programs, and I don't know how much of it is because in Canada they have these support groups, and where the trainers are like they are educated in how what to do with people who have had just recovered from a heart attack. Unfortunately, in India, I find many people it's, oh, so and so has had a heart attack, so he or she should be on complete rest. No, that is not true. Should not be on complete rest. But at the same time, I'm sure, like how you probably do an assessment of, how, what kind of, and interesting thing is for senior fitness, there are so many things available, things like, chair exercises. So as you keep saying, movement is what we like to focus on, and movement in the sense of avoiding continuous sitting. So Akash, one more area which a lot of my people I talk to who find this rather strange is, so many of them are like, they go to gym regularly in the morning before they go to office, like half an hour they're like doing intense exercise. Then after that they sit in a car. This is in Mumbai, let's say. They sit in a car, they're driven to the office by their driver. Then they spend, 6 to 8 hours sitting continuously. And I have to tell them, I said, all that exercise you did in the morning, it is completely negated when you sit for that many hours continuously. And for women, actually, it is much worse. In fact, some studies have shown that irrespective of body weight, even if it's a thin woman who thinks that, she's very healthy, which sometimes is not true when you're looking at someone from the outside. But if she spends the same thing, sitting continuously for 6 to 8 hours at the office in front of a computer and doesn't get up every hour or so, her health is actually much worse than someone who's overweight but is more into movement and exercise and doesn't sit continuously. So these are the two important things that people think that, oh, I've done my half an hour in the gym in the morning, but it's a whole day thing, and I'm sure you have people like that, in your
So
practice as well.
I say sitting is the new diabetes.
Yes, it is. It's like
It is.
this is the
It's
subject of many papers actually.
and
That too,
so even
diabetes sits on a chair.
exactly. I mean, that's probably the worst thing because obviously, as we all know, the body is not designed to sit for so long, and
No.
it's nature. And I always say that when you go against nature, you will have to pay the price.
Yeah.
Having said that, when I teach yoga also, I also have my yoga classes online, and of course I don't do classes every day, and there are people who do classes once a week, twice a week, 3 times a
Mhm.
week. So just
Yeah.
60 minutes or 30 minutes 2 3 times a week is actually not enough. Okay, but
Yeah.
I still tell them that whatever that 1 hour 60 minutes that you do in class, and then after that you immediately go and hunch on your laptops the whole day.
Yeah.
Okay,
Yeah.
it's not going to work.
Hmm.
That whatever 60 minutes or
Yeah.
1 hour that you do, you have to carry it forward rest of the day.
Yeah.
Whatever you learn about posture, standing straight,
Yeah.
everything has to be practiced throughout the day. It has to be part of
Yeah.
your your system. Only then it's going
Yeah.
to work. Having said that, so it's another thing. So one of the main goals that I always say that everybody grows old. Aging is natural. You can't fight it. It's going to happen. But you want to age healthy, in a healthy way. You want to, when you're 80, when you're 90, you want to be still standing up and walking without a walking stick. Okay, that's what
Hmm.
exercise is all about. That's what yoga is all about. That's what strength training. So you want to have that strength to hold your body up. It doesn't make
Hmm.
sense. You may be 95, but if you're hunched up on a walking stick, living on medication and doctors, I mean the quality of life is not there. So it's always about improving the quality of life.
So that is very true. Now, one more thing I wanted to bring up, and particularly this is more relevant for men than women, is men are very focused on their testosterone levels. And testosterone, unfortunately, testosterone levels in a lot of younger people, it's going down dramatically. And there are many reasons, actually, all the reasons we don't even know. But somehow people think, when they think of testosterone, they think of bodybuilders and people like that who are taking testosterone injections. That is not what I mean. What I mean is there are many ways to increase testosterone levels, and you need testosterone, number one, for your metabolism. So diabetes, in fact, the standard recommendations is always for us to check testosterone levels in men when they are diagnosed with diabetes. And secondly, which is very important, is many people are not aware that exercise can increase testosterone levels and growth hormone levels naturally. You don't need a growth hormone injection to increase growth hormone levels. And another thing is nutrition has a huge impact on how testosterone is made. But this unfortunate thing of low testosterone levels in young men, and many of them are not even aware. So yes, exercise is not the only solution, but it's a very big solution, big part of the whole thing. Another area where testosterone in men is very important is in relation to mood, mental health challenges. So Akash, when you talked about, people came to your center and said that they want to lose weight and they want to exercise. So this is another very big myth that people have, that exercise is going to make them lose weight. Now I have to frame it properly. Exercise alone will not make you lose weight, but to maintain weight loss, exercise is very important. Now I have an infographic. I think there's a list of 24 different things that exercise does, exercise and movement. Weight loss is not one of them. So the most important reason I talk about, movement and exercise for most people is mood. So mental health challenges, I'm sure, Akash, you're also seeing, given the ongoing pandemic, particularly amongst young people, it has really become very, very, the incidence is very high. And the solution to, anxiety and depression, particularly mild depression, is not a pill. Exercise has much better, in fact, there was a study quite a few years ago where exercise worked much better than an antidepressant medication in people with mild and moderate depression. I'm not talking about severe depression, and I am not anti-medication. I am a practitioner of Western medicine. But this is the sad thing, people are given a pill first, but no conversation about, why don't you just take a 20 minutes walk,
But that's the thing. See, with all due respect to doctors, and the thing is, it's not. I think it's the whole system. We don't really modern conventional medicine. They don't really focus on on things like simple things. Actually, simple things like nutrition,
Yeah.
sleep, digestion.
Yeah.
Lifestyle. These things are so important. These are even more powerful than medicine. You put them all together, it becomes the
Absolutely.
most powerful pill you can ever
Yeah.
have. But unfortunately, people don't want to do that. So and when you talk about depression, there's certain breathing practices in yoga comes under pranayam. Fantastic for for depression, and not only depression, but even now for a lot of exercise for the lungs, which is so important in COVID. A
Yeah.
little bit of daily practice of pranayam and yoga every day works wonders. Also on
Yeah.
the mind. So
Absolutely.
and I don't know why, because now we have so much time on hand. It's totally up to us how we use that time.
Yeah.
Use it on, you can go for a walk. So if the weather is good, go for a walk twice a day. Why not exercise, do yoga, do pranayam? There's so much you can do at home.
Another important thing that, it's not often mentioned is the importance of exercising for sleep. So sometimes, again, I'm sure you have a lot of clients who will exercise late in the evening because they're coming back from office, and then they go back home and they have a late meal, and then they can't sleep. Now, sleep is extremely restorative. You brought up this topic of, spending 2-3 hours in the gym. 2-3 hours in the gym, the body will look at it as a highly stressful situation. That means, so
Uh,
it's like our hunter-gatherer ancestors. If they had to run for 3
cortisol levels will
hours,
go up.
yeah. So it's a stressful situation. Then the body goes into a mode where, okay, I may not be getting enough food, so I had better conserve all the energy I have into fat. And over exercise is a very big area, which again, we're not going into that today because we're talking more about. So going back to strength training, and when in the time of the day should you ideally exercise? It depends. The most important thing is to do it.
To get it done.
And yeah, get it done is number one. But this is what I tell my patients who have, a lot of women have insomnia issues, like they don't get sleep at night, they don't sleep well, poor quality sleep. So for them, it is very important to start the day with any kind of exercise. If they go to the gym, that is fantastic. If they are at home, even like you mentioned, walking at home or any exercise at home, because what it does is, so for good sleep to happen, our bodies have a temperature rhythm.
Yeah.
So when we wake up in the morning, temperature has to go up, and in the late evening, it should fall. Now, one very easy and very good way to raise temperature in the morning is start doing some kind of a physical activity. So not like wake up in the morning, take a cup of tea and sit down with the newspaper. I don't know what people do, but that is a time when, you can, without looking at the phone, I know what happens when I open my phone and check WhatsApp. There's like a lot of time gone, and my exercise time is gone if I do that. So that is very important, and people don't think of sleep when they're thinking of movement and exercise. That is one, I think I wanted to highlight that. So again, Akash, going back to our strength training, one is the type of training, and I know you mentioned about strength versus endurance. So will you explain for our audience what do you mean exactly, and how do they know that they have strength or they don't have strength?
Okay, if I may, before that, let me just again highlight two very very important things that people need to understand. That why do we need to strength train? One of the reasons is as we grow older, and this applies for everybody, most of women, because women, they suffer from bone density problem, osteoporosis. It's kind of it's waiting there to attack. Okay, but we want to fight it. As we grow older, our muscles, bones, everything starts degenerating. It becomes, when we are young, we can get away with a lot of things. So we may be eating the wrong kind of, we may not be exercising, we may be sleeping late in the night. Life, actually, I have gone through this. Believe me, if I tell you what I used to do in college versus now, it's a 360-degree turn. Okay, I used to party all night, get up late. I mean, it was a mess. Okay, but it's always, you get wiser with age.
Hopefully.
So hopefully, yes, hopefully, and you learn with your mistakes and injuries. So coming back to age, as we grow older, everything starts degenerating. Our bones start getting weak. People start getting a lot of joint issues, back problems, knee problems, shoulder problems. Now you need to remember that a joint by itself, the health of a joint is dependent on the muscles that support it. Okay, if the muscles around it are strong, your joint is strong. So the best way to protect your joints is to strengthen the muscles. And the best way to strengthen your muscles is the obvious, strength training. Now, a lot of people have this misconception that they want to go for a 1 hour walk or a 30 minutes walk, and that covers everything. Now, that does not really work that way. Walking, I don't even call walking an exercise, I call it a movement. Movement is good for you, exercise is even better. Okay, you want to get from movement to exercise. So walking is great, something better than nothing, but especially if you have diabetes, you have insulin resistance, strength training is so essential. If you're suffering from joint arthritis, joint issues, muscular pain, musculoskeletal issues, all that is covered in strength training. All you need to do is just strengthen your bone, strengthen your muscles. And research has also shown that people who actually engage in strength training, if you look at their bone density is much better. The bones are much thicker.
Absolutely.
Just like the muscle becomes stronger, the bones also become stronger with exercise, but the right kind of exercise. Now there is so that this was one of the things that I wanted to highlight, that to actually fight aging, strength training is very very important. And there's a word for this, as we all know, it's called sarcopenia. Sarcopenia is a condition which nobody talks about. No doctor, no medical practitioner talks about. Everybody's talking about osteoporosis, diabetes, and everything, but nobody talks about sarcopenia. It is so common. All of us will go through it if we don't look after ourselves. So extremely important to get into strength training to strengthen your bones and joints so that you don't have any problems as you grow older. Another very important thing is that it protects you from injury. Okay, because if your muscles are strong, okay, you are less susceptible to injury. The risk of injury is much less while performing or while doing any activity. Now, you could be I'm not even talking about exercise, but I'm talking of normal day-to-day work. It could be working in the kitchen. It could be bending down. It could be, if you want to pick up a gas cylinder in your kitchen, anything. Okay, if you're strong, if your bones are strong, your muscles are strong, you become more functional. You improve your quality of life. I always say the body needs to be resilient. So anything it's just like I give an example of a laptop. Okay, a laptop needs to be play every file, any file you throw at it. Could be a doc file, could be an Excel sheet. The laptop has to open it, right? You don't want a laptop that sorry, unable to open. You want your body to be like that. Anything you throw at the body should be able to perform. If you want to run, you want to lift something heavy, you want to bend, you want to reach up and grab something, you don't want to get a spasm in your back. Which is why the body needs to move. And so this brings to my next part, is where we talk about what we say if you talk about fitness, we differentiate, we compartmentalize fitness into different, you could call them components,
Yeah.
of fitness. So you have cardiorespiratory, which is your stamina and endurance. Then you have muscular strength and muscular endurance, which is again very very similar but very different. And then you
Okay.
have flexibility. So
Hmm.
your a balanced exercise program should have a little bit of everything.
Okay.
What is happening right now is people are focusing too much on one of the things. Now, if you look at a marathon runner or an endurance athlete, he
Hmm.
focuses a lot of time only on endurance. I
Yeah.
have seen, believe it or not, I have seen endurance athletes. They can run a marathon, but you ask them to touch their toes, and they can't even touch their toes. Okay,
Hmm.
guess what's waiting for them to happen? Injury.
Yeah.
Because you want that kind of flexibility. Your body has
Yeah.
to be balanced in every,
Yeah.
all from. It has to be an all-around approach. So you
Yeah.
also want to be able to, and another thing is that strength training also gives you strength. For somebody to be able to run a marathon, okay, the impact that you have on your bones and joints, you need that strength in the body.
Yeah.
So there again, coming back to me a personal, when I so about a couple of years back, I injured my meniscus, which is on the knee.
Oh.
I had a knee injury,
Mhm.
and lucky for me, I didn't have to go through surgery or anything. But so
Okay.
when I went to my physiotherapist, he said, "You got saved." You know why? Because of the hypertrophy of muscle around the knee.
Around it. Okay.
So this is how beautifully you can see. You cannot predict when an injury is going to happen. When you're
Yeah.
playing anything, you can do any activity can cause injury, but your
Yeah.
body needs to be strong, resilient for it.
Yeah.
You don't want to give any risk, any chance for the body to get injured. So because of the strength in my quadricep muscles, my muscles around my knee got saved. I didn't have to do much, and I was
Oh,
pretty okay.
that's fantastic. So, Akash, just for the sake of people who may not know what sarcopenia is, I just wanted to mention. So, sarcopenia is again one big, long-sounding word, which makes it sound something very complex. It is basically muscle loss, and it is not always even associated with age. Age is one of the factors when you lose your muscles, and that is a time when you need your muscles the most, but muscles will not grow overnight, so you have to start. I mean, you know that better than me. People have to start much earlier to focus on their muscles. And sarcopenia is, like you rightly pointed out, it is not really talked about a lot. So some months ago I was on a webinar with a bunch of doctors. Two of the doctors were from the UK, one was a movement specialist, then there was a doctor from India who was a geriatrician, and we did talk about sarcopenia, and we were talking about how it is never assessed. In most people it is not assessed, and sometimes it's like simple tests like a hand grip strength, that can also tell us a lot. And low hand grip strength is associated with higher risk for heart disease and stroke. So it's like so many different areas. And Akash, when you brought up bone health, in India, I find a lot of my patients thinking the only thing you can do for your bones is take calcium and vitamin D. Well, just we don't have time to go into the details, but bone health is how much of, we talked about strength training. Strength training is extremely important. Yes, food is extremely important. Protein requirement. Proteins have a huge impact on bone health and muscle health. And I think in part two of this video, we're going to talk about proteins more. And of course, for women, it is menopausal. Hormones are less, then they are not going to make, not going to have enough bone strength. Then there are a whole lot of other, nutrients like, boron and a whole bunch of them. My point is, it is not just calcium and vitamin D which will, strengthen bones. It's like I'm having this to strengthen my bones, and that alone will never do. So that is one thing I just wanted to highlight. Akash, in conclusion of this part of the video, anything else you want to,
If we have the time quickly, I'd just like to touch upon what you had mentioned earlier, the difference between muscular endurance and muscular strength.
mhm,
A lot of people kind of mix the two up, and hence even the training is kind of, it's all messed up. So like
mhm,
when we talk about components of fitness, okay, we talk about cardiovascular, which is separate from muscular strength, is separate from endurance, from muscular endurance, and from flexibility. So you want to
mhm,
pick an activity that covers all this. So
mhm.
running is a fantastic endurance sport, but running can never, you cannot use running for strength training. because strength training is different, running is different. So
Yeah.
it works differently. Similarly, if you're doing yoga, okay, or if you're doing any flexibility activity, that's a separate thing. You cannot use that for stamina, for endurance. So you cannot mix and match everything. This is what people are doing. So one thing is you need to have a little bit of all, so you have a balanced program. Talking about muscular endurance versus muscular strength. Okay, two activities. When we talk about muscular strength, your primary goal is to build strength. Okay, now to build strength, you need to lift. The intensity is very important. How the weight needs to be pretty heavy. It needs to challenge the muscles. Okay, if you take, I see this a lot with women, and it really excites me actually in a gym. By chance, if it happens, when I see a woman or a senior citizen, okay, now these are the ones who always make a mess of things. You will see, I will always see women coming in and I don't know, doing crazy things, and all thanks to their crazy trainers that makes them do crazy things. Stuff like on a Bosu ball, on a Swiss ball, training over. You don't need to. Things that worked 50 years back still work now itself. Same with nutrition. Okay, food worked then, food will still work now. Exercises don't have to be complex. Just because
No.
somebody is showing something fancy on Instagram or Facebook doesn't mean
Yeah.
it's going to work for you. It probably has
Yeah.
never worked for them also, but it just looks good. Okay,
Yeah.
so when we talk about strength, you only want to focus on building strength in the gym. And how do we do that? By lifting a challenging weight. Now, when we talk about lifting weights, okay, the repetition of weight that we do in an exercise should be between 6 to 8 repetitions.
Oh,
That means if you can do an exercise more than 8 reps, you need to increase the weight. Now, this is pretty
okay.
advanced, okay, but obviously you will start with lighter weights. You will start with 20-25 repetitions so that you learn the exercise. You build a neural pathway so the body understands the exercise, the body adapts, and eventually you want to get to 6 to 8 reps. But the problem is that a lot of even men actually, women, because they have this misconception that they lift heavy weights, they become bulky, and we don't want to get muscular. Trust me, guys, getting muscular takes years and years and years of not only exercise but nutrition. Okay, so whether it's fat loss or muscle building, okay, 80% is the food that you eat is nutrition. That's why they say abs are made in the kitchen, not in the gym.
Yes.
So no
Yeah.
matter what you do, if your nutrition is not on track, you will never see results. Okay, so when you're talking about strength, the weight has to be pretty heavy. 12, 20, 25 repetitions for an exercise is not going to work. So a lot of people, again, there is a misconception that when you do light weights, you're building muscular endurance. When you're lifting heavy weights, you're building muscular strength. Okay, but guess what? It doesn't work like that.
Okay.
Using light weights to build muscular endurance is a very inefficient way to train.
Oh,
Okay,
okay.
very inefficient way to train. A more efficient way, guess what? So when you are muscular endurance is something which gets covered when you're in your cardiovascular exercise. Okay, when you're running, all the muscles that you engage in running, you are building muscular endurance for them along with your cardiovascular. Okay, but
Yeah.
training the same muscles in the gym with light weights, you are not. You think you're
Not good.
building endurance, but it's actually a very inefficient way of training. I always say that if you have 30 minutes to train, or 40 minutes, or even 20 minutes, you want your best bang for the buck, right? You put in 100%, you want 100%. But if you're putting
Yeah.
in 100 and you're getting only 10 or 20, it's an
Yeah.
extremely inefficient way to train. So no matter what you do in the gym, it's got to be efficient, it's got to be optimal. If you're focusing on strength, only focus on strength. If you're focusing on endurance, if you're focusing on muscular endurance, go run. Don't come and do 20-25 reps with those light dumbbells. With all the women, you've seen in the aerobic studios and all that women use very very light weights to do exercises. Now guess what's happening there? Okay, you're neither here nor there because you're not building, definitely not building strength, and you're
Yeah.
very inefficiently building muscular endurance, but you're sweating it out. You're sweating it out. Okay, the heart rate is going up. Okay, you think
Yeah.
you're having a great workout, and sweat is again not a very good determinant for a workout. You can
No.
have a fantastic workout and still not break into a. So it's not really a tool to measure your workout. So this is where people get confused that the only
Yeah.
focus in a gym to build strength is lift weights and heavy weights, challenging weights.
Challenging.
So that's one of
So,
the differences that I wanted to highlight. So
Akash,
we
one
can,
thing I wanted to
yeah.
wanted to mention because we're talking about building muscles and strength training. So when people look at their body weight, and this is where I always tell them, don't look at the number on the scale, because the number on the scale is measuring your fat mass, it's measuring your bones, your organs, your muscles. Versus if you're looking at body composition, and I know your gym definitely has one of those machines, and though the ideal test would be a DEXA scan, no one has to go through that. You can just even, I'm sure in your gym you have some instrument which measures that. So why I wanted to highlight that is
Very, very important
muscles,
point.
yeah, muscles weigh more than fat. So if you are going, like someone is going just by the number on the scale, they have no idea whether they have gained muscle or they have lost fat and gained muscle. So the final number has remained the same, but body composition has changed dramatically. This
Absolutely.
is something that, losing even 5% of body fat and gaining some muscles is much, much more important than, any, 2 kgs, 5 kg loss that they might have seen. So do you
So,
find that often?
yeah. So the first thing that when somebody comes to me for training, the first thing I tell them is throw your scale out.
Yeah.
That weighing scale needs to go out of the window, okay? Because that is extremely inaccurate. It's
Yeah.
not a correct tool to measure your fitness. There is no yardstick to measure your fitness. Okay,
No.
when we talk about now when I spoke about the components of fitness, the last one which I did not say because I thought it would confuse people is body composition.
Mhm.
Okay, that is so important. We call it body fat, and right, a DEXA scan is the best way to do it, but not everybody can afford it or
Not
everybody has access.
necessarily.
But a lot of gyms have a decent kind of a setup to measure body. They have a body fat machine. What
Yeah.
I myself, I carry a body fat monitor in the house, a small one that you
Mhm.
can hold. May
Yeah.
not be very
The
accurate.
handheld.
Yeah,
Yeah.
handheld may not be very accurate, but it gives you some direction where you're heading. So your
Yes.
only goal, especially when you're on a fat loss program, your only goal you want to make sure that you reduce your body fat month after
Yes.
month. Okay, that's the only
Yeah.
way that will tell you you're on the right track. Don't look
Yeah.
at your weight. Your weight can fluctuate. Okay, it's
Yes,
just
this is just yesterday I was talking to a lady. She wants to lose weight and she's checking her weight every day. I said, if you don't mind, are you open to checking it once a week? Because you may gain weight because of extra fluid in your body, but you are disappointed. My program's not working. I'm working so hard. All those. I said no. And I have had actually patients telling me, doctor, is it okay if I don't weigh myself? I said, yes, absolutely. Because when you lose weight, there is no way you will not know. You know?
even
So it's like
yeah,
that's
even
body composition is
nutrition
so
is so
much more
important.
important.
Which is why even BMI, but the body mass index, is
You
not
know,
very
you just
accurate. But a lot of doctors still use that as a guideline. But they don't
Akash,
understand.
this is you brought up. My God, we can go down so many rabbit holes.
Seriously, it's like a rabbit's hole.
Yeah, you brought up BMI, which unfortunately in India, I still find a lot of places following the Western BMI cutoffs. So Asian BMI cutoff is different. It is much lower, number one. Number two, BMI, as you rightly pointed out, is not the best measure of fitness at all. So a waist to hip ratio, which is much easier to measure, is a much better marker. And again, another very easy marker, which you sometimes don't even have to measure, is waist circumference should be half of someone's height. Now,
Yeah.
most people know their height, though. One thing that bothers me is sometimes with age and bone collapse, some people lose height. So unless they're measuring their height, and most people know what their waist size is because they're buying clothes. So very rough measure, no fancy equipment required, is waist measurement being half of height. That is one important thing. BMI, as you rightly pointed out, it's not accurate. And number one, number two is many people are still following the Western BMI of 25 as being the cutoff. For Indians, it is I don't even go into BMI. I think it's
Yeah.
23. So Asian BMI is very different because South Asians, so people from India, Pakistan, Bangladesh, Sri Lanka, we have something called, skinny fat, or we are tofi. So tofi is thin outside, fat inside. So South Asian people have metabolically very unhealthy fat around organs. And it can be seen with, belly fat is one of the big things. So sometimes I'll have women tell me, I don't have a weight problem, but their bellies are sticking out to the point where I'm wondering, is she pregnant? Like, and they think that because they've gone by BMI, you know. So BMI
See,
is
it's
fine,
not.
but she's unhealthy.
Yeah. Even a lot of men. So skinny fat is actually a very it's a very different you could call them a category of people, because and it's a little tricky to approach for a trainer, or to train for a trainer, because
Yeah.
you're neither here nor there, so you don't really want to lose fat because you're pretty skinny from all over. It's only the belly that's kind of protruding. So it's
Mhm.
a little bit, it's a very tricky situation for a trainer, how to train. But skinny fats are again very common in men, especially who are
Yes.
skinny. But at the same time, they have this, ugly
Yes.
fat in front of their
Bulging belly.
stomach.
Yeah.
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 So let me also ask you one in question. In your line of functional medicine, when you consult a client and all, do you also emphasize on exercise as a part of
Oh,
of the
absolutely.
training? And if exercise,
Absolutely.
then do you also talk about strength training?
Again, it depends, Akash. What happens is there are so many different, things to talk about. So we do bring it up. I definitely bring it up because one of the things I check in my intake questionnaire is the sitting disease risk. So there is there's a online form that they fill up. So most of the time, and again, like you said, walking is not the best exercise, but if someone is like sedentary all the time, very unlikely they're going to suddenly tomorrow morning start joining a gym and working out. So I tell them, okay, let us
Some.
start with a small goal. So if they're wearing a fitness tracker or something, so what is your baseline? Many of them it's like less than 5,000, which is absolutely sedentary. Okay, 10,000 may seem like too far away for you, but so in my intake questionnaire, I have questions about, because not everyone is sedentary. There are some people who are very active. So next thing is, if they are sedentary and less than 5,000 steps a day on an average, then I say, okay, why don't you look at moving to 1,000 more steps for this week? That's just a 20, not even a 20-minute walk. Like 1,000 steps is nothing really. So yes, I do, talk about movement and not so much exercise as more about movement and preventing sitting disease. And of course, like I don't have a physical trainer like you or someone in our office here in Calgary. We have where they get a fitness assessment, hand grip strength, and things like that. But I do bring it up. And some of my patients actually, they are already going to the gym, and so they'll ask, doctor,
Great.
should I continue with the gym? I said, yes, that is the one thing you don't want to give up. You know. So of course, with the ongoing pandemic, it has become quite difficult for a lot of people because gyms have. So are gyms open in Pune now?
No, I don't see them opening for another month at least.
Oh, okay.
Uh,
So I know
yeah.
you started some online classes. So you're continuing with those?
So last year we had SutraLETICSS, the entire team actually of all our trainers. We did a
Mhm.
free, actually it was a free session for, I think, what was it, for 1 month or 2 months we did a.
Oh, wow.
So every day we were doing a class with different teachers, so different classes every day. So people don't
Wow.
get bored of the same. So somebody,
Mhm.
because even though let's talk yoga, if there are 4 or 5 teachers doing yoga, each one has a
Mhm.
different style. Each one has a
Mhm.
different class. So giving something new to people, and it was a free session. So every day I also took a couple of sessions. And the good thing is that some of the videos are already been uploaded on our channel. So we have a SutraLETICSS YouTube
Okay.
channel also. So if you're interested, you can always welcome to go there and check videos out over there.
Okay. Thank you. So,
And yeah,
Akash, just summarizing the things we talked about. Number one is why strength training. So it's very important for your metabolism, for managing blood glucose levels, whether you're pre-diabetic, you have diabetes already. And in India, I don't think there is anyone who doesn't have pre-diabetes. 95% of my
I,
patients
I
have.
always say I always say that you're either diabetic or pre-diabetic, and if you
Yeah.
think you're not pre-diabetic, you don't know it yet.
You don't know it. Yeah, that's true. So strength training, very important for that. And high intensity training, Akash, interestingly, a lot of new research is coming out from the world of psychiatry. So using higher intensity training for some mental health conditions has shown a huge impact, because one of the things is that different chemicals are secreted when you exercise. One of the big ones is BDNF, brain derived neurotropic factor, which is also important for prevention of dementia and things like that. So this is one area where there is a huge opportunity, and it is, people are not really exploring it, because I don't think any psychiatrist will write a prescription for high intensity or moderate intensity exercise to manage their depression, but it really works. There is science supporting it. It's not like me talking from the top of my head. That is one thing I wanted to stress upon. Why do you need to build strength and strength training? The other thing is, what are the different components? So one is the training, and as you brought up, nutrition. So in second part of this video, we'll briefly talk about protein intake and how that contributes to building muscles. Because remember, you build muscles not to look muscular. It is for longevity, it is for better metabolism, it is for, a well-toned body looks very different compared to someone who may be thin but they don't look healthy.
Exactly. And like you said, muscles are very metabolically active.
Yes. So I think now, any last words, Akash, you want to add? And one suggestion I have for people is, if you are afraid of, strength training or anything, my suggestion is always dip your toes and see how you feel. Sometimes when you do strength training for a few days, you feel so much better. Forget about weight loss and how much your muscle has changed or anything.
Just enjoy the experience.
Feeling.
Just enjoy the experience.
Absolutely. I've personally experienced that in the days I do, weight training at home, like even 5 minutes of it, I feel much better than the days I don't do. The days I do some, walking at home or something like that. So, Akash, any last words, or we'll move on to the second part where we talk about protein?
Yeah, so I hope that after seeing this, some of you may have got inspired, may have got motivated to hit the gym. So normally in my earlier talks, whenever I do these talks sometimes on health and fitness and all, and sometimes I see people immediately the next day they send me a message, we got so motivated, so charged up by you, we went and joined the gym. So I'm really looking forward to that, and I hope some of you actually do that. And please follow SutraLETICSS. There is a lot of content coming up there on fitness, on health. We have videos also coming up shortly. So there's lots of things happening there.